Mrs. Jones. My name's Morgan. I'm a student at the University of St. Francis. I'm just going to be assessing you today. I'm going to come over here and wash my hands. First, I'm just going to start off by doing some vital signs. Start off by doing your blood pressure. Everything looks okay there. Next, I'm just going to take your temperature. You just open up for me. That looks good. Can you tell me if you're in any pain today? Nothing, you're doing okay. Next, I'm just going to listen to your breath sounds, and then I'm going to listen to your bowel sounds. Everything looks okay there. I'm just gonna put some gloves on. I'm just gonna look at your breast here. Have you noticed any tenderness or any cracking with your nipples or anything? No? Okay. I'm just gonna go ahead and lift these up. Just tell me if anything's tender or anything. Okay, I don't see any cracking, nothing, no lumps or anything. Everything feels okay. I'm just gonna move down here and look at or feel your uterus. The top of it is called the fundus. Looks like it's midline, it's firm, it's about 1 centimeter below the navel. One thing I can teach you is that you can massage your own uterus. This will make it move down a little bit more. So you can just do that. You just put one hand here and one on the bottom, so just use your 2 hands and massage it down. I'm going to move down here and look at your pad. How long ago did you change your pad? About an hour ago, okay. It looks like it's rubra. It's about a moderate amount. I don't see any clots. There's no odor or anything, so that looks good. I'm going to go ahead and flip you over and take a look at your incision, which we call the episiotomy. I don't see any hemorrhoids back here. Looks like there's no redness, no edema, no ecchymosis, no discharge, and the edges are approximated, so that's good. Your epidural site looks good too. I don't see redness or edema there. Go ahead and flip you back over. Can you tell me when your last bowel movement was? Earlier this morning, okay. You've been passing gas and everything. Can you tell me when you last went pee? About an hour ago, okay. Any burning there or anything? No, okay. I'm going to go down here and look for any clots or anything. I don't see any redness or edema down there. Just relax for me. I'm just going to, it looks okay there. I'm going to do it to the other leg. Did you have any pain or anything when I did that? No, okay. So everything looks okay there. I'm not seeing any edema or anything. Another thing I can teach you is if you notice that your discharge is going from like the yellow or white to red again, that may mean that you're doing too much and you just might need to slow down a little bit. Also, some signs of hemorrhage is that if you're having to change your pad like a lot, like more than once in an hour, that just and it's like bright red bleeding, then you may need to call your doctor and just get that assessed. Just make sure also that you're going to the bathroom every 2 hours because you're used to having that baby sitting on your bladder, so you just might need to retrain it. So retrain yourself to go every couple hours. I'm just going to take a look at your IV site here. Everything looks okay. If she had a Foley, I'd go ahead and look at that to make sure everything was okay there. If she had a cesarean, I'd also look at that. Go through Rita again with that, but she doesn't have one. She was calm and cooperative, talking to baby the whole time. Do you have any questions for me, Mrs. Jones? No? Okay. Well, thank you for your time.